There is no doubt that raw onions are among the most nutritious and flavorful foods, widely praised for their health benefits. These versatile ingredients are rich in essential nutrients, such as vitamins, minerals, and antioxidants, contributing positively to our overall health and wellness. From salads to sandwiches and salsas, it seems like everyone is finding ways to incorporate raw onions into their diets. But did you know that they might not be suitable for everyone? That's right. If you thought raw onions were universally beneficial, think again. In this video, we're going to explore the common side effects of consuming raw onions and why you should avoid them if you have specific health issues or while using certain medications. Some of these side effects occur not as a result of existing health issues or medications, but rather because of the way some individuals' bodies react to raw onions. So stay with us because by the end of this video, you'll have a clear picture of when to avoid raw onions and how to use them wisely to reap their beneficial effects. We will also reveal the results of groundbreaking scientific studies that show how you can maximize the benefits from consuming raw onions, as well as how you can use raw onions to improve the absorption of beneficial nutrients from other sources. Raw onions are celebrated for their impressive nutritional profile. They are an excellent source of vitamins C and B6, folate, potassium, and antioxidants, which support immune function, heart health, and overall wellness. The sulfur compounds found in onions, such as allicin, contribute to their health-promoting properties, including anti-inflammatory and antimicrobial effects. But first, let's start with conditions where you should avoid raw onions. Number 1. Kidney health. Raw onions are high in potassium, which is essential for various bodily functions, including regulating fluid balance, muscle contractions, and nerve signals. However, for individuals with chronic kidney disease, managing potassium intake is crucial. When the kidneys are not functioning properly, they struggle to filter excess potassium from the blood, leading to hyperkalemia, a condition characterized by dangerously high potassium levels. Symptoms of hyperkalemia include muscle weakness, fatigue, irregular heartbeats, and in severe cases, cardiac arrest. Nephrology studies highlight the importance of monitoring potassium levels in individuals with kidney disease. If you have compromised kidney function, it's essential to consult your healthcare provider about your dietary intake of raw onions to avoid potential complications. Number 2. Liver health. Raw onions contain sulfur compounds, such as allicin, which are known for their detoxifying properties and can support liver health by aiding in the detoxification processes. However, for individuals with liver conditions like fatty liver disease, excessive consumption of these compounds can place additional stress on the liver. While moderate intake can be beneficial, consuming large amounts of raw onions may exacerbate liver issues by increasing oxidative stress and inflammation. Studies have shown that while sulfur compounds can help with detoxification, they must be consumed in balanced amounts, especially by those with pre-existing liver conditions. If you have a liver disease, it's important to discuss your diet with a healthcare provider to determine the appropriate amount of raw onions you can safely consume. Number 3. Digestive disorders. Raw onions can cause significant digestive issues for some individuals due to their high fructan content. Fructans are a type of carbohydrate that can be difficult for the small intestine to absorb, leading to fermentation by gut bacteria, which produces gas and bloating. This can be particularly troublesome for individuals with digestive disorders such as irritable bowel syndrome, IBS. Consuming raw onions can exacerbate symptoms like abdominal pain, bloating, and gas, making them hard to tolerate for those with sensitive digestive systems. Gastroenterological advice often includes reducing or avoiding high fructan foods like raw onions to manage symptoms better. If you experience digestive discomfort after eating raw onions, consider speaking with a healthcare provider or dietitian about your symptoms and dietary adjustments. Number 4. Irritable bowel syndrome, IBS. For those with IBS, raw onions are particularly problematic due to their high FODMAP content. FODMAPs, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, are types of carbohydrates that can trigger IBS symptoms by fermenting in the gut and causing increased water content and gas production. Studies have shown that reducing FODMAP intake can significantly alleviate IBS symptoms. Since raw onions are high in FODMAPs, they often lead to increased bloating, gas, and abdominal discomfort in individuals with IBS. A low FODMAP diet, which excludes foods like raw onions, is commonly recommended for managing IBS. If you suffer from IBS, it's important to be mindful of raw onion consumption and consult with a healthcare provider for personalized dietary advice. Number 5. Allergic reactions. While rare, some individuals may experience allergic reactions to raw onions. Symptoms of an onion allergy can range from mild to severe and may include skin rashes, itching, hives, swelling of the lips, face, tongue, or throat, difficulty breathing, and even anaphylaxis in extreme cases. These reactions are caused by the immune system mistakenly identifying certain proteins in onions as harmful substances. Allergy research indicates that individuals with a known sensitivity to onions or other allium vegetables, such as garlic, leeks, and chives, should be cautious. If you suspect you have an onion allergy, it's crucial to avoid raw onions and seek advice from an allergist for proper diagnosis and management strategies. Number 6. Medication interactions. Raw onions contain compounds that can interact with certain medications, particularly blood-thinning medications like warfarin. Onions have natural anticoagulant properties due to their sulfur content, which can enhance the effects of these medications and increase the risk of bleeding. Additionally, onions can interfere with the metabolism of other medications, potentially altering their effectiveness. Pharmacological studies emphasize the importance of monitoring dietary intake of raw onions for individuals on blood thinners or other medications. If you are taking any chronic medications, it's essential to discuss with your healthcare provider how to manage your consumption of raw onions to avoid potential interactions and ensure the effectiveness of your treatments. Number 7. Heartburn and acid reflux. Raw onions are known to exacerbate symptoms of heartburn and acid reflux due to their high acidity and gas-producing effects. The consumption of raw onions can relax the lower esophageal sphincter, allowing stomach acid to flow back into the esophagus, leading to a burning sensation and discomfort. For individuals with gastroesophageal reflux disease, GERD, or frequent heartburn, eating raw onions can significantly worsen these symptoms. Gastroenterological advice often includes avoiding trigger foods like raw onions to manage and reduce the frequency of acid reflux episodes. If you suffer from heartburn or GERD, it's advisable to limit your intake of raw onions and consult with a healthcare provider for personalized dietary recommendations. Number 8. Blood sugar management. While raw onions have been shown to have potential benefits for blood sugar control, they can also affect individuals with diabetes. The sulfur compounds in onions, such as allyl propyl disulfide, may influence blood glucose levels by enhancing insulin function. However, these effects can vary among individuals. For some people, consuming raw onions may lead to fluctuations in blood sugar levels, which can complicate diabetes management. Studies have indicated that while onions can be beneficial in moderation, excessive consumption should be monitored. If you have diabetes or are concerned about blood sugar levels, it's important to track your response to raw onions and discuss your diet with a healthcare provider to determine the appropriate amount for your condition. Did you know that you can enhance the nutritional benefits of raw onions even further by combining them with the right foods? Let's take a look at what recent scientific studies have revealed. Raw onions are already packed with vitamins, minerals, and antioxidants, but recent research has illuminated a fascinating discovery. Consuming raw onions alongside other nutrient-rich foods can actually boost the absorption of those nutrients in your body. A recent study reported that adding raw onions to a salad can act as a nutrient enhancer by increasing the absorption of flavonoids and other antioxidants, which help protect the body from damaging compounds. In the study, people who consumed a salad containing raw onions absorbed significantly more antioxidants from the vegetables. So what's the science behind this incredible nutrient boost? It all comes down to the unique compounds found in raw onions, such as quercetin. Raw onions are rich in these compounds, which help your body absorb and utilize other nutrients more efficiently. But the onion effect doesn't just apply to salads. Another study published in the Journal of Nutrition found similar benefits when raw onions were paired with various nutrient-dense foods, enhancing the absorption of their inherent antioxidants. So how can you put this knowledge into practice? Well, try adding sliced raw onions to your favorite salads, mixing chopped onions into your morning omelet, or using them as a flavorful addition to your vegetable stir-fries. Not only will these onion-centric meals taste great, but they'll also provide your body with a powerful nutritional boost that can support everything from heart health to a stronger immune system. If you want to learn about the numerous benefits of raw onions, we have a different video where we discuss that in detail. It's linked in the description. So what about you? Do you enjoy raw onions? Have you experienced any unusual symptoms after consuming them? How often do you eat them? Also, what benefits have you noticed from consuming raw onions? Share with us in the comments section below. If you enjoyed the video, don't forget to like the video, subscribe to the channel, and hit the bell icon so you don't miss out on the next video.